Good evening, viewers. Welcome to another very interesting episode of our Instagram Live. Okay, today we're talking about a very interesting topic that will interest every one of us. The topic today is period pain, debunking myths, and managing menstrual health. I am Dr. Omotosho, and with me here is
Dr. Febian Obakeye. Good evening, viewers.
okay. So we're going to be starting. So we are in the year 2024, and you would think that menstruation and everything concerning women health and period will be something that was about, but yet issues concerning period are still something that are considered taboo topics in our world today. And this shame culture has led to many misconceptions and many myths about periods, and particularly about period and menstrual pains and cramps. And that's why we're discussing this topic today. So first of all, what is menstruation? What is menstrual cycle? What is so? Dr. Obakeye, please can you give us a small?
So yes, menstruation is the monthly shedding of the lining of the uterus, which in lay terms is referred to as the womb. And it's a monthly thing in that it's cyclical, and there's a correlation between this and the ovary. As the ovary releases hormone, you have you have the effect of the hormone on the lining of the uterus in preparation for pregnancy. And when this doesn't occur, it sheds monthly and menstruation.
Okay. Okay. So how many days is a period considered normal? How many days do you have to bleed for before your period is normal? Because you can say you're bleeding normally.
It varies from individual for between women and between young girls.
Okay.
Yes, the day between normal periods varies. For an individual, you will have to start with a cycle length. What is ideal cycle length? It has to be between 21 to 35 days.
Okay.
And the duration of flow should be between 2 to 7 days. Anything less than 2 is referred to hypo, less than what is expected. And more than 7 days is more than what is expected. And once this clinical scenario is there, that individual has to see a gynecologist for further review and evaluation.
Okay. Okay. So you say between 2 to 7 days.
Yes, for the duration of flow and
Okay.
for the cycle length, that's the interval from one menses to another.
Okay.
That's what's referred to as cycle length.
Okay. So from day one of one cycle
To yes, to the onset of the next cycle, that's what's referred to as the cycle length, and it varies between 21 to 35 days. That's the ideal. So we've had instances where people come to say, "Oh, my menses is not regular." I'm following evaluation. They tell you that it's usually between 26 days. Now it's now 24. But since the difference between that usual pattern and the new one is just a difference of 2 days, it's still referred to as a regular menstrual cycle. Unless when it exceeds 7 days, that's when you can say, okay, it's not regular, it's not a regular cycle.
Okay, so if I see my cycle end this month was for 22 days, and next month 24, next month 26 is still normal.
Yes, it's still a regular cycle.
Okay, so at what age do women typically start menstruating?
Yes, people start menstruating, it varies, but on the average, 12 years. However, if menstruation begins earlier than 8 years, that's referred to as precocious puberty could have occurred before that onset of menses takes place. Or if it's later than 16 years, that's still not appropriate. So between that 10 to up to 16, or later than 16 is not acceptable.
Okay.
So but on the average, most young girls would have their first menses occurring between 10 and 14 years of age.
Okay, because we have seen women complain and saying one of their daughters started their period at 10 and there's this one at 15 yet to start, so there's no cause for alarm.
Not in totality, but there are other things you have to look out for. Aside the age, you have to find out the secondary sexual characteristics that things will expect before the menses come. Development of pubic hair,
Okay.
axillary hair, all those has to be present. If that is present and still at the age of 14, the young girl has not seen her menses, has not attained menarche, she needs to come to the hospital for gynecological review. to exclude any background cause. Or if there's still absent secondary sexual characteristics, and at 16, no menses and all those have not developed, no pubic hair and not axillary hair, that's also not normal. Such has to come for
For
yes
evaluation.
evaluation.
Okay, so now we've been talking about menstruation. So now we're going to cruise of our topic, period pain. What exactly is period pain? What causes it?
Yes, period pain has been defined in medical terminology as dysmenorrhea.
Okay.
Yes, a medical term for painful period, and about 70 to 80% of women may experience it. Yes, and it could be primary or secondary. Primary meaning, oh, there's no known cause and occurred just about 1 to 2 years after onset of menses, attaining menarche, meaning the first menses the young girl has had.
Okay.
Or secondary, much later, the young girl or the woman wasn't having that painful menses, and all of a sudden it started. It could be due to underlying gynecological conditions that will require further evaluation.
Okay. So now, what can cause that secondary dysmenorrhea? I
Yes.
don't used to have pain before, and all of a sudden I start having this painful menstrual period. So what can be the causes?
Yes, aside that, there could be some baseline background gynecological condition. First, lifestyle modification has to be evaluated. Take, for instance, the person wasn't taking alcohol, wasn't taking caffeine, wasn't smoking. Yes, that can have a bearing on the menstrual, on the person developing menstrual pain during menstruation. And the secondary things that could also cause it, if there's endometriosis, that's where you have the endometrial tissues, which is supposed to be lining the endometrium. You find it outside the uterus.
Okay.
Yes, it's found in the peritoneal cavity, such that when menstruation is ongoing, those tissues also bleed wherever they are in the ectopic sites that they're supposed to be. Ideally, they're supposed to be lining the uterus. That can cause pain and cramps during menses. If you also have adenomyosis, that's a condition where you also have the endometrial tissue within the muscles of the uterus. Ideally, that's not supposed to be. So that will also cause pain during menses. Or if there's a pelvic inflammatory disease called PID from procedures or from sexually transmitted infections, that can also lead to painful menses, which will occur much later um, in the context of being secondary dysmenorrhea. Ab initio, it wasn't there when menarche was attained, wasn't there 1 year, 2 year later, much later as the woman grew older. So that can be attributed to.
Okay. Now, are there things that can predispose you to having painful menstruation?
Yes, like I said earlier, you could have risk factors
Okay.
that can cause painful menstruation. If the individual is younger than 20 years of age, she could be at risk. Like I said earlier, there may not be any known cause if it's a primary, yes. But sometimes, if it's as a result of premenstrual syndrome due to hormonal fluctuations, that can also cause dysmenorrhea, meaning painful menses. Yes, but that's on its own. For individuals that have risk factors, they tend to have heightened pains during menstruation. If they take alcohol, or if they smoke, or if there's a family history, or they are younger than 20 years of age, they are at risk of having painful menses. And if they've never been pregnant before, or they started their period much earlier before the age of 11 years, or women who are also overweight, or women who have irregular menses,
Okay.
such that when the menses come after, probably they have a polycystic ovaries, and it has skipped some months. When there's return of menstruation because of excessive shedding,
Yes.
yes,
very,
they tend to
very
have
painful.
painful menses.
Okay, so that's very interesting. Okay, so now what about we know that some period can be painful, but what is about my period that will make me come to the hospital? What will happen to my period that will make me think, okay, this time I have to go to the hospital to see a gynecologist?
Yes, if the menses, the pain becomes unusually painful, Yes, the individual may have had a pattern of menstrual pain or coming in 1 to 2 days before the onset of menses. Yes, that categorizes as primary dysmenorrhea. But if this pain becomes unusually painful, heightened, yes, that may be if a red flag for further evaluation, just to exclude any background underlying gynecological condition. Or if the bleeding exists for 7 days,
Okay.
or period pain that feels more from the ordinary, like what I've said before, or if the pain progressively gets worsened, affecting the individual's quality of life, meaning they have to take time off school, off work. Yes, it's debilitating. The individual can't go about her normal daily activities. Yes, this would require a review by a gynecologist just to exclude other background gynecological conditions.
Okay. So now what about the volume of the period? The volume of the period blood. What's the normal volume?
Ideally, it should be between 30 mils to 80 mils.
Okay.
But it's difficult to quantify
Yeah.
the quantity of blood by a young girl until what I have is more than 80 mils. So what you use is the number of sanitary pad that's been used. If it's in excess compared to what has previously
usual.
been used, yes, more than usual, yes, that may be a red flag for evaluation.
Okay. Thank you very much for that. So now what can so if I for example have menstrual pain, what can I do what can I use for menstrual pain ordinarily?
Yes, for menstrual pain, it's important to emphasize that what causes this pain is a release of a chemical in the body called prostaglandins.
Okay.
Yes, so in the course of shedding of the lining of the womb, it causes some pains and crampings. Yes, so what can be done as a home remedy from diet? You can take meals that are less, have anti-inflammatory effects,
Okay.
such that the level of the prostaglandins that may be produced may be
Not
reduced. Yes,
right.
it can have effect on it. Having balanced diets, having vegetables, nuts can also help. Having exercise and adequate rest, and having warm baths at the time of menstruation can also help reduce cramps. Massaging the abdomen and um, using drugs
Okay.
like pain reliefs can also help cope with the process of having painful periods. Where this doesn't work, there's room for hormonal drugs that can be used, especially for individuals that have premenstrual syndrome, because of the hormonal imbalance that causes their own pain, not necessarily because of the level of the prostaglandin.
Okay.
Yes, those ones can benefit from pills, yes, estrogen containing pills that would help alleviate the symptoms.
Okay. Thank you very much. Okay, so we've been talking about menstruation, menstrual cycle, period pain, the types of period pain that we have, the causes, what can cause period pain. So we are going to be talking about myths. Now, we have had different things. Before I got into school, we've had different things about the menstruation, the cramps, of how it happens, what you should do, what you should not do. Some people are not allowed to go to religious places once they are on their period. Yeah, that there are some things that menstruation limits you as an individual. So we're just going to be discussing about some of this and how we can work around them. So one of the first most common things we have heard, especially from people that don't experience it, is that period pain is not real. So Mark, can you talk about that?
Yes, period pain is real. Like I mentioned, about 60% of young girls and women would experience painful periods. Yes, and this is not like a pathognomonic of a disease condition in their body, especially when it's primary dysmenorrhea.
Yes.
Yes, it's something that has to do with the level of the chemicals in the body. That's the prostaglandin. Yes. So the only consequence that it may cause if it's for primary is time out,
Yeah.
loss of time at school, at work,
Yes.
and the debilitating pains, yes, of the pain. But it's real, and it's not like it's a disease, especially if it's in the context of primary dysmenorrhea. Unless if it's secondary, then further evaluation is needed to exclude the background gynecological condition.
So Very important. Period pain is very real. Okay, so another thing I've heard is that people can tell when they are menstruating. That, for example, if a girl is walking on the streets now, you can tell that this girl is menstruating, this girl is not. How real is that?
Well, that is not. There are no telltale sign for you to identify a woman who is having her period or period pain as at that point in time, unless she manifests with symptoms. But that as an individual is passing, like, oh, the menstrual menses have a particular smell, and you can deduce that this individual is having her period at that point in time. Those are myths that should be debunked.
Thank you very much. So another one we have heard is that when you take drugs to relieve the pain, they can cause infertility. How true is that?
That's not true. Like I mentioned, that those are measures to alleviate the pain. They have no bearing in causing infertility for the woman and for the young girl or for the woman. And it's important to say that it's not out of place to take analgesia for relief of menstrual pains. They have no bearing on causing infertility in the future, yes. So it can be used.
So we've also heard that women should just lay down. They should not do anything. They should not exercise. They should not do anything when they are on their period, especially when they are having period pains. Is that also a lie?
That's also a myth, an erroneous impression. Actually, exercise is one of the measures that has been instituted to improve the menstrual pains that women have during their periods. Yes, exercises, regular exercises. It doesn't have to be something strenuous. It could be a walk, it could be breathing exercises, relaxing exercises. This helps to alleviate pain such that the need for analgesia may not even come up. So these are home remedies that can be instituted. So it's not out of place to get them done.
Yes,
Yes.
you can also use them as distraction techniques sometimes.
Yes.
So my was about showering and bathing with cold water. That if you bath with cold water, your pain will increase. How is that?
No, that's not true. That bathing with cold water would increase pain.
Yes.
But it depends on individual preferences. But what the evidence has shown that with warm bath, it tends to improve it. So, but if there is if there are reasons why that individual cannot have a cold bath at that point, a warm bath at that point in time, yes, cold bath will not be out of place. But yes, so it's not like it's going to have any injurious effects on the woman's health. Yes.
About food. Now we know that balanced diet is good, but we have that some particular food, sour food, cold food, and sweet food can increase menstrual pain.
Yes, some have advised that sugary foods could be avoided.
Okay.
However, that's still inconclusive. But if you look at how the pathophysiology of how menstrual pain comes, yes, this may not be tenable, so to say, but there are measures to help improve the severity of the pain. So cold food, sour food won't have a bearing on that. But cutting down on one's caffeine level using foods like Coke that has coffee, that has high caffeine component, that would help improve menstrual pains at that point in time. But it not necessarily have to do with cold or sour food. Avoiding smoking, that will also help to improve menstrual pains.
Thank you very much. Okay, so we've already said this before, but the way of recapping, some people believe that a woman's period should be clockwork. So if you see it on the first of this month, you must see it on the first of next month. You must see it on the first. If you see it on the second, then there's something wrong. So can we debunk that too?
Yes, that's not true. Like mentioned earlier, you have women who have their cycle length is the same.
Yes.
But as they grow older, you could have fluctuation in the menstrual cycle. And I said once the interval is not more than 7 days, yes, it's within normal range. It's not out of place, and it's not as if a disease condition has happened to them. Yes, the range is between 21 to 35 days, and fluctuation between that individual menstrual cycle length should not be more than 7 days. It's when it's more than 7 days that will prompt for further evaluation to exclude any background gynecological condition. So it mustn't be clockwise, so to say. So If there's variation, but the variation is within 7 days, it's still acceptable and not out of place.
Okay. Another thing we've heard is that period sync. So for women who have been together for a long time, they start to have their period at the same time. Is that true or not?
That is not true. There is no recent study that I've found that okay, because we are friends, that means our period will come about the same time. No, but evidence has shown that for the period pains, if there's a family history
Okay.
of sisters that have period pain, there's risk of other young girls in that family to have period pains, but not necessarily that their period will come at the
At the
same
same
time.
time.
Yes.
Okay. So another very common one that most people believe is that if you have sex during your period, you cannot get pregnant. Is that true?
Well, it's less likely to happen, especially as it takes the sperm about 5 days. But if you have a short cycle, it's possible. It's possible.
Okay. So if you're having sex during your period, there's still a chance of
Because
pregnancy.
yes, because as a period, with the onset of a period, a new cycle has already started.
Yes.
So, but some have that erroneous calculation that until the menses stop, that's when another cycle starts, and that's when they start calculating their supposed safe period and all that. But the truth is that once our menstruation has started, with onset of menses, a new cycle has actually started, and it's possible.
Okay. So another thing we've heard very common is that period pain stops after childbirth. Is that always true?
It's not always true. It's not always true that period pain will stop after childbirth. But for individuals that their period pain is as a result of primary dysmenorrhea, there was no underlying gynecological condition that caused it having issue. For those ones, as they have children, it tends to improve.
Okay.
Yes. But if the period pain was as a result of a background gynecological condition, say for instance there was fibroid or there was endometriosis or there was adenomyosis or PID, it may not necessarily stop. Yes, it may still linger even with childbirth.
Okay. Okay. Then another one is once you miss the day your period stops, like this, you're pregnant. Is that true? Is that always true?
That is not true. Like I said, you have variation in the number of duration of flow among women. Yes, at the onset of menses, a new period has started, and on the average, most would have for like 5, 7 days. I told you the range is 2 to 7 days. So at that seventh day, ovulation has not even occurred, even depending on the cycle length of that individual. So it's unlikely that even if intercourse had taken place which around that period, that pregnancy would have occurred. Yes, so it's not likely that once you miss your period, that pregnancy had occurred. Missed period could be as a result of irregular cycles, like the context of polycystic ovaries.
Okay.
So if a woman has polycystic ovaries and her period are irregular, it doesn't mean that she's already pregnant. Yes.
Okay.
So test has to be done. She has to carry out a test, a pregnancy test, to confirm that she's pregnant. It doesn't mean that once period stop, she misses her menses. That does not translate into pregnancy. And it's important to emphasize that for younger girls who have just attained their menarche, meaning they've just had their first menses, subsequent menses don't tend to be regular.
Yes.
They tend to skip before regularizes. So at that point, you can't say they've gotten pregnant. So that's not true that if you miss your period, that translates automatically to a pregnancy. Yes.
Okay. So another one is for people that use tampons. They say if young girls use tampons, they lose their virginity. Do you have to say about that now?
That's not true. That one a tampon is used, that virginity will be lost. Um, Virginity is something that has to do with insert hymen, that the hymen has not been breached, but tampon overlies it, so it's unlikely that it will be broken. And for you to have an hymen that is not intact, it has to be like a forceful penetration. You understand? Or for women who indulge in exercise like horse exercises, yes, but we don't have more of our girls indulging in such exercises. But on its own, having to use a tampon will not break the hymen and make a woman lose her virginity. So during period, we advise that sanitary pads should be used. Yes.
What about period blood is dirty blood? You know, some people don't even want to touch them or anything about it because the blood you are producing from your body is dirty, it's contaminated, and that's why most of these women are not allowed into temples and into religious places and even told to sleep outside. We've heard seen stories where they in India and some of these countries they are told to sleep outside the family house because they are on their period. So what do you have to say about period being dirty blood?
We can't say that period bloods are dirty blood or contaminated blood, so to say. It's a physiological process. It's not a pathological thing. For a woman to have her menses, it's not like there's a disease that is ongoing in her body. It's a physiological thing, and period blood is as a result of the shedding of the lining of the endometrium. It's a normal physiological process. The endometrium is a normal part of the woman's womb, the normal woman's uterus. So what brings about the shedding is because there is no fertilization that will have resulted into implantation. So once it's shed, what the content is just debris in the endometrial tissues and altered blood from ruptured blood vessels lining the endometrium. So it's not contagious, so to say. So women, viewers out there should take note that it's not contagious. So if you have contact with women that are menstruating, doesn't mean that a disease condition would arise afterwards.
Okay. So another one, I think this should be final one for now, is that women are built for pain, and so anybody that takes pain medication when they are on their period, they are not helping themselves during childbirth. What's the basis
That's
for
also an
that?
erroneous belief and should be debunked. Yes, women having pain, like we said, the pain is not like their own making.
Yeah.
Yes, it's physiological thing, and because of the hormonal changes and the prostaglandin levels, like we said, it could vary. Some may not even have it, some may have it, the severity also varies. So for some that their own pains are moderate or severe, they will require analgesia, and it does not stop them from having conceiving in the future. It doesn't stop them from being able to cope with the labor process when they are pregnant. So they should be allowed to use analgesia if they can't cope with the severity of the pain.
Okay. So thank you very much. Okay, so we've been talking about the myths surrounding period pains and period as a whole. So if you have any other question or clarifications that you need to clear up, you can send them as messages and as comments on the. Okay, so we're going to be talking about the second part of our presentation, which is menstrual hygiene. So menstrual hygiene, what is it, ma'am?
Yes, menstrual hygiene has to do with measures put in place during menstruation to ensure, okay, the woman is well, she's clean, there's no body odor, yes, and she still goes about her normal daily activity, not like as if there is menstruation is a debilitating condition for her. So those are the things, what menstrual hygiene involves, things she needs to do to keep herself clean and go about her normal daily activities without interference because of menstruation is ongoing.
Okay, so what are some of the safe menstrual hygiene products that we women can use during the menstrual cycle?
Yes, using sanitary pads. Start using sanitary pads. But we've had women because of the economic recession having
Yes.
to use clothes
Yes.
and all that. Well, it's
Pads
not
are expensive.
yes because pads are expensive, but it's not like this is encouraged. But if that has to be done, it has to be washed and kept clean. If that has to be done, ideally disposable pads is actually the best,
Okay.
so that you discard the menstruum and then any debris.
Okay, so usually in Nigeria, pads, in fact, around the world, pads are usually the most common menstrual hygiene products that are used. But recently, we've been seeing an increasing use of menstrual cups and menstrual tampons and dips. So
Yes, it's not common in our environment, but they are not out of place where it's available. If for any reason, because we've had individuals that have complained about reactions to the conventional pads that they have itchiness,
Yeah.
yes, skin reactions, allergic reactions, and all that. So those are substitutes for women who can cope with the conventional pads.
Okay, so for somebody that is just maybe starting her menstrual cycle, what are the things that she can do to maintain menstrual hygiene even before the period starts?
Yes, it's to prepare her mind, okay, that this is a cyclical thing and will occur from every month
Yes.
and up until menopause. So it's not like a one-off thing that we have seen for this month. I don't think I need to bother myself about menses again.
It's part of your life
Yes,
now.
yes. So once it starts, that's menarche up until menopause occurs. So it's something the individual has to learn to cope with. Okay, trying to have a calendar to note your the dates so that you can calculate your
Possible days.
cycle length. Yes, when the next menses is going to occur, and have a sanitary pad handy because you don't want to just sit up and you're soiled and someone has to draw your attention. Oh, you're staying from behind.
Yeah.
You understand? You just carry your pants along when you're expecting your period so that you're not caught unawares and at that time you have something handy to use because it can be at an odd hour where you can't even go to a nearby shop to buy one to use at that point in time. Yes, and to have fancy liners few days before the period starts. So if for any reason you don't have one handy, you don't get to saw it before you can lay your hands on one.
Yes, I always encourage women to always have pads ready, available with them, whether on their period or off, because you don't know who you're going to help. I can't count the number of times somebody has come to ask me, "Do you have a pad?" So you should always have one ready and available. You don't know who you're going to help, yourself or somebody else. So during the period, what can we do?
Yes, taking one's bath regularly stand to improve one's personal hygiene. Washing the genital areas. There's no special care about the genital area, not because I've had instances where some have to use soap and water, scrubbing the place,
Yes.
using wash, and like I want to make it. Just taking your normal bath, you pour water and you rinse, that would suffice. You understand? Then if you have to use the toilet, just clean up. You don't have to douche, and also use clean hands. You have to change.
Yes.
The one you use in the morning is not the one you're going to use at night, just to improve your personal hygiene and reduce the risk of infection.
Yes.
And it's also important that once pads are put in place, you have to change once they are soiled. You don't have to leave them for long because that can predispose to infection. You understand? So those are the measures to put in place for a young girl who is already menstruating or anticipating that her menses may come soon by virtue of her age. And also discard usable ones, wrap them clean in the nylon and discard appropriately. And it should not be thrown in the toilet that can block your sewage.
Yeah.
It should be properly trashed in the dustbin.
That's very important. Thank you.
And also using hand sanitizers after each and
You should always wash
change.
your hands.
Wash
every
and
time.
use hand sanitizers.
Thank you very much. Okay, so what are the after menstruation care? So what should you do after menstruation?
Yes, after each, you just observe your cycle, how long has it lasted, and keep a calendar. That helps you to
Yes.
keep track of your menstrual cycle and the duration of flow. Noticed anything? Are there flaws or still the same pattern? Or if you've experienced pain, is it increasing in severity or it's still the same way? Yes, that would help you to take decision earlier rather than if there is no chart and if you're asked, when was the last menstrual cycle? It's difficult to recall.
Yes,
But if
yes.
you have a calendar or charted it on your phone, it's easier to recall. So after each cycle, take note and document and await another cycle.
So she said something very important. For every woman, every girl, anytime you come to the hospital, you're always going to be asked what's your last menstrual period. You should always. That's why having a calendar is very important so that you don't. It will not be difficult to remember your last time. Okay, so now we're just going to talk about the different menstrual hygiene products. We've talked a bit about them. So what are the pros and cons? So we probably have a young girl that is probably about to start her period and she's wondering, okay, what is the best one that I can use? What's bad about this one? What's bad and good about the other type? If I don't want to use pad, what else can I use? So
Yes, there are different types. Some have used tampons. Well, it's a good option for athletes. However, it could be cause what we call toxic shock syndrome if
Yeah.
used for too long. You know, I mentioned that pads should not stay, sanitary pad, especially if they are soiled, should not stay for too long. Yes, because of the organism that could arise from there and lead to toxic shock syndrome. So, but it provides protection because you don't have an external bulk.
Okay. So once you if you're using tampons, always remember to remove them. If you leave them behind, it can expose you to infections. Like, okay, what about pads? What are the benefits of pads?
Yeah, it's good for people who are just beginning their period. Yes, it's light, it's easy to carry around, and can be safely worn even when you're sleeping overnight. Yes, but cost may just be one of the drawback,
Yes.
especially in current times. But you should be aware that you have to use more than one. You understand, and change more frequently. And if you feel that the blood seeps out, you can change the type you're using. There are various types in the market.
Yes,
Yes,
thickness.
the thickness, depending on your flow. Yes, if someone that has light flow, you may not necessarily get one that is bulky. But if flow is heavy, you have to get one with a more improved thickness that can easily absorb and prevent stains of underwear.
Thank you very much. Okay, what about cups?
Well, they are reusable longer term. Like I said, for those who have allergy to the conventional pad, yes, it could be an option for them. Yes, and it can stay for a longer time. Or it could be unpleasant to clean, difficult to use in public places, you understand, and can be difficult to use, especially how to insert and
Yeah.
carry them around.
You have to be taught how to use it
Yes.
effectively, or else it will be embarrassing when it fails. Okay, so um, thank you very much. Okay, so in for the past few minutes, we've been talking about period pains. We've been talking about menstrual cycle, normal and abnormal period cycle lengths and period days. We also talked about some myths about period pains, about false things, and we hope that we've cleared up some of our questions. But like I said earlier, if you have any other questions, please put them in chat box that we would know. Also talked about menstrual hygiene, things that you can use during your menstrual cycle that could help. Sima, do you have any other?
Yes, just to recap to our viewers who are just joining us and can miss the part of our discussion, so we can recap for them to catch up from where they joined in. We talked about what menstruation is, and we said it's a physiological process
Yes.
that occurs in women with uterus. So it's not a condition that you'll find in men because they don't have uterus. So it's a cyclical thing, and it's a shedding of the endometrial lining of the uterus. And that's because it sheds if there's no pregnancy, there's no conception, no implantation. So it's a cyclical thing and it's a physiological thing and should not be seen as a disease. However, if you there are various time where menarche will be attained. That's the first menses of the young girl. It varies. The fact that one had a particular age does not mean the other will have.
Have it at
Yes,
the
even
same
among
age.
siblings,
Yeah.
you could have one that attained menarche at 10 years and the other one at 12. So there shouldn't be anxiety.
Yeah.
So the only thing that will prompt the mother to bring the young girl to the hospital for gynecological evaluation is that if there's development of axillary hair, there are second sexual characteristics, there's pubic hair, and
Breast.
yes, and the breasts have developed, and menstruation had not occurred after 14 years. Yes, can bring the child for evaluation. Or if it's earlier than 14, you could just observe you have fluctuations between siblings. So it doesn't mean because the sibling has had hers at 10, the other one must have her own at 10. So if it doesn't exceed 14 and you don't have all these features, there's no cause for alarm, there's nothing to worry about. However, if you also have all these features not occurring, no secondary sexual characteristics occurring, and the young girl is already at 16,
16 years.
that's another indication to bring the young girl for evaluation. My fault. Oh, okay. We'll have questions coming in. We can address that before we continue.
Okay. So we have a question here. It says my child has had her first period in November. Until today, she hasn't seen any period. Is it okay?
Yes, we mentioned that following onset of menses, that's the first menses,
Yes.
because there's what we call the hypothalamus pituitary ovarian axis
Yeah.
from the brain to the ovaries. There's a connection. So because it's immature in these young girls, their menses don't tend to be regular initially. So they may have their first menses and some months will elapse, it won't come initially. So it's nothing to worry about. It's certainly okay.
Okay. So just give her time, the period will come back. But how long does she have to wait before she comes to the hospital?
If 6 months elapses and there's no period, should bring the child
Okay,
to
so
the hospital.
6 months after, then you can bring her to me. Any other question? Okay.
Yeah, so
Please
before more,
bring in your question before more comes in.
yes, we're talking about the menstrual cycle and we talked about the cycle length. Yes, for those who are still joining us to benefit from that discussion, that you have a range. So the fact that an individual's own is 22 days or 24 days, or the usual one people have gotten used is 28-day cycles. You understand how my cycle is 28 days and they're having someone else having at 26 is not out of place. It's still within the normal range,
Yeah.
provided it's between 21 to 35 days. And even for that individual who has had a regular pattern, there's still room that it could change. You could have fluctuations in the menstrual cycle that could alter the cycle length, such that it's no longer 28 days now, it's beginning to become 26, 25. It's still on course, so it's not irregular, so to say. Okay, so we'll have another question.
Okay. So it says that my period takes about 4 months before I see its next one, and usually painful and lasts more than 7 days. What do I do?
Yes, for this individual, we talked about duration. Yes, like for the first question that came in, the menses was absent after the initial one, after attending menarche. Yes, we said that was not out of place.
Yeah.
Yeah, so for this one question, we need to know how old the individual was and
Yes.
the period she was talking about. Is it the first period or subsequent periods? You understand? So if it was subsequent periods, say for instance, it has always been normal and all of a sudden it's taking intervals, yes, you will need to come to the hospital for evaluation to exclude any background gynecological condition. And she said, my period takes about 4 months
months.
before I see it. The next one usually painful and lasts more than 7 days. Yes, I mentioned that for women, as part of the course of painful periods, is for those who have irregular cycles, such that when the menses return, because of excessive shedding of the endometrium, the menses will be heavy and it will be more painful. Yes, so such individuals also have to come to the hospital to exclude any background
Okay.
gynecological
So,
condition.
Ma, please, we are inviting you to see a doctor urgently to exclude and for a very important gynecological evaluation. Okay, so Ma.
Yes, we also talked about the pains. We've had what we call primary dysmenorrhea. Dysmenorrhea is the medical term for painful periods, and secondary. Primary meaning it occurs about 24 to 48 hours before the onset of menses. Yes, for those ones that are primary, you may not have an identifiable cause. Main thing is because of the chemical we talked about, the prostaglandin. Yes, which is in excess. So the quantity in the body has a bearing on the severity of the symptom. It's just small, it may just be mild, such that the individual doesn't experience any menstrual pains during menses. And if it's severe, the pains become more during menses. So the quantity in the circulation in the blood has a bearing with the severity of the pain the individual experiences. Okay.
Okay, so another question has come in.
Okay.
Say my partner requests for sex in my period, but I refuse and it's causing troubles. I can't do that. I feel irritated. How do I explain to him and make him understand my take?
Yes, people have it's a common question people are concerned people have had. Okay, can I have sex during my period and all that? Yes, it's not like there's a clear cut instruction or health reason in quotes the health reason that had been proposed was that there could be risk of endometriosis if there was retrograde menstruation, but that was not conclusive. It was just an hypothesis as a cause of endometriosis, that may be a cause, that during intercourse with the backflow of menstruum passing through the fallopian tube into the peritoneal cavity, that could cause, but that was just an hypothesis. So, but mainly the reason why people would want to abstain from sex during menstruation is for just some health reasons, hygiene purpose. You don't want to get everywhere soiled with menstruum and the whole place is red. So, but not necessarily because it has a serious health consequence, aside this one that I've mentioned with concerns about endometriosis in the future.
So what we're saying is that there's no serious health risks, but you should probably talk to your partner and help him
Yes, just
understand
for
where you are
hygiene
coming
purpose,
from.
yes.
Yes. So it's more like a discussion. Okay.
And for those that even have like dysmenorrhea, having painful period,
Yeah.
having sex at that time may not also be pleasant. You understand? So it becomes more painful, and the woman is not in the right frame of mind. So that's one of the reasons why, okay, it may not be encouraged. But it's not like, oh, there's a clear-cut instruction that during um, during menses do not have sex. But because of this other reason, it's advised that, okay, after the menses is over, intercourse can resume.
So now we're talking about just recapping.
Yes, about menstrual pains. Yes, and the myths that um, occurred around menstrual pains. And we talked about, we're trying to explain about the primary dysmenorrhea that occurs about 21 to 2 days before the onset of menses. It lingers for just about 3 days and stops. But if you have, the pain is going beyond that 3 days, there will be need for a gynecological review just to exclude any background gynecological conditions.
Okay. Okay, we have another question. Is there anything I can do to make my period last for only for 2 days? It's really taxing wearing pads for days. She wants to just asking, can she reduce her
Menstrual flow. It's a physiological thing. One may not necessarily be able to reduce the duration of flow, especially if it's not heavy. Most times you have gynecologists intervening if the menses is heavy. Yes, it's heavy and affecting the quality of life. But to shorten the duration is a physiological thing. It will take a course. After the shedding is over, it will stop. But what the emphasis is on trying to reduce the menstrual pain. But if the flow is heavy, you need to come for evaluation and let's quantify how heavy this flow is. We've talked about the volume, and we said, okay, it may not be easy to quantify the volume of menstruum during menstruation, but the quantity and the number of pads used, that can help give an insight to say, oh, if if the menstruation is heavy or not. So, but reducing the duration of flow may not be achievable, so to say, because the physiological thing is after the shedding, as the endometrial lining is being shed, the menstruum comes out and eventually stops.
So we will not advise you to take anything to shorten your duration of flow, especially when it comes like that. Okay, so another question is, please can you explain irregular periods and how it can be corrected?
Yes, we talked about regularity of the period, and we said first, it comes at intervals that are already timed, you understand?
Yes.
For an individual, it could be 28 days, it could be 26 days. But on the average, it should be between 21 and 35 days. Once it's less than 21 days, that is hypomenorrhea. That is not ideal. And once it's more than 35 days, that is oligomenorrhea. That is also not ideal. So for one to say one's period is irregular, meaning it comes this month and it's beyond these 21 to 35 days, you understand? It's taking about another 2 months to come. That's an irregular cycle. Or it takes another 6 months to come. That's an irregular cycle. But if it takes few days interval, take for instance, this, the individual cycle length has always been like 26 days, and now the next cycle is 24. That is a regular cycle. because the interval between the normal for that individual has not exceeded 7 days. So that is a regular cycle. It comes every month, and you can deduce the time is between these 21 to 35 days. And for that individual who already has a pattern of a cycle length, the difference should not be more than 7 days. So if the regular pattern for this individual is 28 days, she's been having 28 days, it should not be less than, if you subtract 7, that's 21 days. And if you add 7, 35. So it should not be more than less than 21 days, and it should not be less than 35 days.
So just to add, the count these days, we are counting from the first day of your period.
Yes.
The first day of your period is your day one. So days after that is just that's the 28, the 35 days, 28 days. Accounting from day one. So if you start your period on the first, that's your day one till 30 days after plus 5 days. So anything after that 35 days, so the next month and 5 days extra, then you start getting worried and say, okay, this is an irregular period.
So, like we said, so if it's outside the contents of what we discussed, that would qualify for an irregular cycle. For such individual, you will need to see a gynecologist to exclude any background gynecological reasons or endocrine reasons why the cycle is irregular.
Thank you very much for listening to us. We have been talking about period. As I imagine many of us have many questions to ask. We all know that period is a very important menstruation. Sorry, it's a very important to each and every one of us because more than 52% of the world population are women, and so are female. And so period and menstruation as a topic is very important to us as a world and as a world health problem. And so if you have any other question, you can let us know. A very interesting time together with my.
Okay, so before we say goodbye to our viewers, we'll also have this opportunity to emphasize on menstrual pains. Yes,
Yeah.
because it's something that's affected the quality of life of some individuals. They have to take time out from work and from school. Yes, and have to cancel some appointments because of menstrual pain. Or it's something that can be managed, so to say. It's not like, okay, we talk about myths and taboos that, oh, once there's menstrual pain, don't do anything, just keep bearing the pain. You can we talked about some lifestyle modifications that can help improve the quality of life, and you can still go about your daily activities as if nothing is happening. You can use say cut down on your caffeine level, no smoking, no alcohol, regular exercises, have enough intake of fruits and vegetables, and also nuts. Those are diets that have that can reduce inflammation. They're anti-inflammatory, so that would help also reduce the effect of the prostaglandins. So, and there's also room to use for analgesia. So using analgesia is not out of place and will not have any bearing on the individual future fertility, because that have been reasons that have been proffered that using analgesia may have a bearing that the individual will not be able to conceive in the future. Yes, those are misconceptions and myths that should be debunked. So analgesia can be used during when individuals have menstrual pains to reduce the intensity of the pain and also improve the quality of life. And there are also room for hormonal drugs. I talked about using birth control pills. So that will also not stop conception, because birth control is not out. Using birth control pills, that may not make you to conceive in the future. No, that's an erroneous belief and should be debunked. That would help to cope, especially for individuals that have premenstrual syndrome, which is as a result of hormonal fluctuations. It helps to control these hormonal fluctuations and help them to cope with subsequent menses, such that the need for analgesia would even reduce. Yes. So those are measures that can be used. Breathing exercises, it's not out of place. And also
Hot water bottles.
yes, hot water baths and all that, massaging the abdomen. Those are home measures to help reduce the intensity of the menstrual pains. We also talked about the myths in having menses and have to stay indoors. That's not true. And that, oh, once you're menstruating, you have this order that people perceive that you're menstruating, and that's why we emphasize on personal hygiene.
Yeah.
Once you instill this, you have your bath regularly, use deodorants. Yes, there's room for deodorants. It's unlikely that body odor will arise and you can go about your normal activity and you don't have to stay indoors because you're menstruating. Okay, so we also talked about the types that can be used. We talked about menstrual hygiene and what kind of products that can be used during menses to improve the quality of life for that young girl. I also talked about home measures aside drugs that can be used. So if you have other questions, feel free to send them in. We're here to address the questions concerning period pains and debunking myths about menstrual health and patterns.
So if you have other questions, even after the video is over, come to the any hospital and we'll address all your concerns. Thank you very much, ma'am, for being with us today. Thank you for educating us on period pains, some of the myths, and debunking some of it. Because their period is, like I said previously, it's very important to the society. Learning about them from the right source, especially, is very important, health education wise. So thank you very much, ma'am. Also telling us about menstrual hygiene. I'm very grateful. So it's been a lovely time with you. Thank you very much, viewers, for listening to us and speak about period pains, debunking some of the myths and menstrual hygiene as in general. So thank you very much. Have a lovely day.
So thank you viewers for staying out and having a nice time with us this evening. Where we talked about period pains and debunking myths and improving their menstrual health. We look forward to another section, another interesting episode with you. For now, bye bye.
Bye.
Lovely evening.